Hello, my topic today is strategic extraction assessment using cone beam CT. My name is Jeffrey Miller. I graduated from Towson University, did my dental training at University of Maryland, got my orthodontic certificate at SUNY Buffalo, and I've been in private practice for over 31 years. When we talk about strategic extraction patterns, we're usually talking about pulling different teeth to help achieve a final or improved final result. For example, if you have a Class 2 Division 1, instead of pulling first bicuspids, you may choose to pull upper first bicuspids and lower second bicuspids. Or if you have a tooth that's clinically damaged, if you have a bombed out tooth, you may elect to extract that tooth versus another tooth. If you take a look at this case, I picked this case because I think for most orthodontists this will be a first bicuspid extraction case, all four first bicuspids. I know there are some outliers out there that would consider doing this case non-extraction, but for the most of us orthodontists, extractions would be indicated in this case. At least I believe it. I believe that would be the case. In this particular case, let's say, for example, you knew that the lower right second bicuspid had significant decay and would need a root canal and a buildup and a crown lengthening procedure. Would you consider extracting the lower right second bicuspid versus the lower first bicuspid if you had that information? Well, I think the answer is yes for most of us. In this case, if you take a look at the lower right quadrant, the lower right lateral incisor seems to be ectopic. There seems to be some thinner tissue associated with that lateral incisor. What if you knew that the bony support for the lower right lateral incisor was compromised? Would you consider extracting that versus the lower first bicuspid? Well, with cone beam CT, you can assess the bony support for individual teeth, and that can help you make a good clinical decision of what tooth you'd want to extract or what you don't want to extract. It's impossible to evaluate the bony support for individual teeth using a Panorex or a subtometric X-ray. With all the superimposition of the structures, you can't determine the bony support for individual teeth using those two-dimensional radiographs. It's just impossible. So when we talk about the bony support for individual teeth, we use something called total root bone coverage. It's an empirical formula that gives us the relative percent of the circumference of the root that is covered with bone. For example, in this particular case, the lower right lateral incisor has 89% total root bone coverage, which is actually pretty good. And then you can compare that total root bone coverage to the lower right cuspid, which is 79%, or the lower right first bicuspid, which is a 90%. Now, I was really hoping that one of these would show a 50% total root bone coverage, and then it was kind of more of a no-brainer, and we would extract that one tooth in that lower right quadrant. But that didn't happen. It's interesting, sometimes just looking clinically, you can get fooled. With cone beam CT, you can measure individual teeth, and that's the beauty of 3D radiographs. Also need to consider the bone support for the final position of the tooth that you're going to move. Is there enough bony path to properly retract or maneuver the tooth to its final position? And in the final position, is there enough bone there? Thanks for listening. If you have any questions or comments, my email is ortho606@gmail.com. Hope you found this presentation interesting.